What is shingles or herpes zoster? So shingles is a viral infection which causes small vesicles or blisters on the skin. Now, how do you differentiate it from other skin infections or skin lesions? The diagnosis of herpes zoster is almost clinical. You do not require elaborate tests to diagnose it. It appears as a transparent, fluid-filled, shiny blisters that you see on any part of the body. What is different in herpes is that it never crosses the midline. That means suppose you have a lesion here, it is going to extend from here to the back but will never cross the midline. That means from the front it is never going to go to the other side of the body, and from the back, it is never going to cross the midline. So any red rash which is very painful and is on a particular area not crossing the midline, the first thing that you should think is herpes zoster. I think it is one of the most excruciatingly painful condition present. There's no other skin problem which causes so much pain. Any age can be affected. It is the same virus which causes chickenpox. Now, what happens is when you have chickenpox, which presents as small fluid-filled small vesicles, they're spread all over the body. They can be present anywhere, and then you have fever with it. This is when you have chickenpox. Once the chickenpox heals, what happens? The virus is very smart. It doesn't go away from the body. It stays in the body. It hides in your nerves and stays there in an inactive form. Now, throughout your lifespan, whenever there is a reduction in your immunity, be it because of some chronic illness or stress or any, it could be, increasing age, especially after 50 when the immunity drops a little. So that is the time when the virus reactivates. It's already there in the body. It just reactivates in that area where it has hidden, and it will cause a skin rash, a painful skin rash. The pain occurs because the nerves gets irritated, and it doesn't spread to the whole body. Causes the rash only in the distribution of the nerve. That is very important, and that is a very peculiar sign which differentiates it from other skin rashes. Now, what to do when you have such a painful rash? If your rash is diagnosed, it is very easy to treat it because they are very effective antiviral treatments. The other thing to remember, and which is very important in the healing, is the sooner you start the treatment after the development of first symptoms, the sooner your problem will subside. The sooner the symptoms will subside and you will get complete cure. Any treatment which is started before 48 to 72 hours will not lead to any residual complications. But if the treatment is started later, then there are chances that even after the lesions heal, you will still experience pain in the area where the nerve was or in the area where the lesion was. And any pain which is persisting for long after the skin rash subsides is known as post-herpetic neuralgia. You can reduce the chances of developing post-herpetic neuralgia if the disease or if your rash is diagnosed early and the treatment is started early. So the points to remember is any rash which is painful, extremely painful, not crossing the midline, you should always think about herpes, and once it's diagnosed, immediately start with antiviral treatment. That is the best way to avoid complications or persistent chronic pain after the lesion. Thank you.